Hi there. This video is for those of you involved in setting up and running the recall system in your practice. One really useful part of the system is advising staff what appointments a patient needs. And to do this, the system works out what conditions need review, how has your practice been configured, and then generates a list of free slot searches that need to be used. Now, in order to set that up, you need to first understand what free slot searches the system needs for your setup. So if we come to clinical reports and innovative health systems, or it may be Welby Innovate by the time you view this, IHS recall. And the first thing just to check is this localization folder. So if you've joined us recently, we will have gone through this with you as part of your setup. However, it is something that's always growing because as new practices join, they have new ideas or new things they want configuring for them. And it may be things we've not really thought of before. And you look at it now and you think, actually, no, we want that. So, for example, you can see here, there's an option to include women's health in your reviews. So that would include HRT checks, pill checks, those sorts of things. If the number here is showing roughly your practice list size, it means you have opted into that option. If it's showing 0, you haven't. If there's things you find in here that you want changing, we've put up here our email. Drop us an email there and we can quickly and easily change it for you, and the system will update accordingly. Now, a key part of this that we may have gone through with you is certain conditions that you may or may not want to include, like atrial fibrillation or peripheral arterial disease. They would normally have annual monitoring if you're using the best practice invites, but not a full review unless you opt in. Similarly, there's an option with diabetes and cardiovascular reviews to do those in 2 stages. You can see the default is 1 stage. And then there's other options like blood. So some of you have bloods done elsewhere. Some do bloods as a kind of first step. The default setup is that bloods are done as part of kind of initial appointment, which may well be bloods, OBS, lifestyle advice for sort of general CVD type review. There's also things like whether you combine different respiratory reviews. So, for example, in some practices, some of you have nurses who only do asthma or do asthma and COPD. Some have different lengths of time for those things. If, however, it's the same nurse or nurses who do those reviews and have the same length of time, you can opt into this and the system will combine them. So it will simplify the guidance for reception staff. There's other various options here, and doubtless in time more will be added because we want to make this work for all of you. The next place to look is this folder here, Annual Review Free Slot Searches. So here you've got the long list of potential free slot searches, but don't panic, you don't need to configure every single one that's in here. So lots of these, again, for your practice will show 0s. So for this particular practice where we host the system from, we don't do 2-stage CVD reviews or diabetes, so no patients are appearing in there. We do combine respiratory reviews, so you've got respiratory and respiratory including bloods, but these ones here are showing 0s. What you can do is order it to see the free slot searches you need. It can also be useful to give some kind of indicator of the likely demand you'll have. The way this is set up at present is it shows patients who are either annual review blue, so they're due an invite some point in the QOF year, red, they've not responded, or amber, they've had some reviews, but not these particular ones that are still outstanding. Now, I'm recording this, as you can see, on the 25th of March, just coming up to the end of the QOF year. So the numbers are relatively low given this list size. When I run these next week, the numbers will be much higher. So there are patients and reports in here that may show 0s, but next week might start to have some patients in them. There are options with ECGs because patients could do with them if they've had a recent hypertension diagnosis and certain medications require ECGs. And there's the option in the request test template for a clinician to ask for an ECG. If you really don't want that including, or you want it completely separate, that's one of the localization options. Let us know, and that will reduce the number of free slot searches you need to configure. How you configure them is up to you. So for some practices, it may be that Bloods and obs, you give the same length of time, it's the same staff. Some practices give less time for bloods only and more time for bloods and obs. You might have different staff with different skill sets. The beauty of this approach is that you can build the free slot searches to work for you as a practice, but with your localization options, the advice and guidance your staff are given should match with what you've got available and what you want to book. Separately, we've got a video that we'll provide about how to configure free slot searches, or we can help you do that. But for now, this is really just to explain how you see which free slot searches you need, and also to give a sense of the numbers that you're likely to need. So yeah, if I run these next week, and you may want to do the same, it would give you a rough indicator across the entire QOF year of how many appointments you might need. Obviously, that's based on the premise of everyone responding, which we know they don't. Data we've pulled previously suggests around 2/3 of patients respond to invites. But that might be helpful for you to plan your capacity out and have some kind of understanding of the nurse HCA levels that you're likely to need for this part of your practice work. Hope that helps, and do give us a shout if you need any more help or if there's things that you want configuring differently for your practice. Thanks.